autism is a developmental area where individuals might have different types of experiences developmental-wise, where they can have some examples include sensory challenges, challenges in processing certain situations and social situations, and multiple factors that can include physical health as well as mental health. So some symptoms might include being socially withdrawn, having trouble communicating with others. There might be some physical symptoms associated as well, but something that I'd like to mention is the behavioral aspect. You might see some individuals display property destruction, self-injurious behaviors, but we just want to make sure that we understand that's not with every individual. It can just be a result of a reaction to certain stimuli, or when they have difficulties in us understanding what they're trying to communicate to us. There can be a lot of scrutiny towards individuals with autism, and whether some professionals or even people in public who might think that an individual who has autism, an example, they have a behavior, they might say, oh, be careful, watch out, don't let my child go near that person of autism. That's something just to keep in mind. And then for practitioners, it's having that unrealistic expectation that, oh, this patient I'm about to see has autism. I better make sure that, I get things out of the way. I better make sure that I don't cause anything to where they harm me. So it's making sure that if we do see or we provide a diagnosis for individuals with autism, that we do not just have them as labeled as such, and that we still treat them with empathy and as humans as well. There is no one way per se of diagnosing, but a commonly used approach is what's known as the ADOS, and it's where certain practitioners are able to provide that sort of play therapy, but also assessment in determining if they meet the standards and qualifications. There's also meeting the standards in the DSM-5. So that's, and then practitioners such as pediatricians will also look for signs when they're at a very young age as well, before the age of 2 years old. And when we have all that information, we provide the sort of diagnosis. And the reason why it's important for young ones to receive this is because insurance companies can provide and accommodate to those services that can become really beneficial. And that talks about, and we'll talk about it later, but one of them is called ABA services, Applied Behavior Analysis. And that's a commonly used and considered the gold standard in behavior management and treatment for individuals with autism, but also helping develop quality of life skills, being able to communicate with others. And the earlier, the better. An early intervention for anybody can be very beneficial. So that's why we want to make sure that we can get that diagnosis as soon as possible, so insurance can provide the coverage for those early services for them. Absolutely. So for this one, I like to tell practitioners that it's about learning how to understand those individuals with autism. So being able to attend a CE, a conference, or a training, or consultant for people with autism. So that way these practitioners can have the skill set in mind, and it can be tailoring the environment. So as we mentioned about stimuli before, decreasing the brightness and lights, having a sort of safety pod room. I always forget the way that they describe it, a sensory room that can be able to adjust with any symptoms of anxiety that they may be expressing, and just having that sort of safe environment for them. We talked about applied behavior analysis. That's considered the gold standard for early intervention for children of autism, but there is also mental health counseling, because there is comorbidity. Individuals with autism can also have symptoms of anxiety, symptoms of depression, especially growing up, learning how to communicate or not having that many friends because they feel that they're different. So it's about being able to address those other issues as well, or challenges. And then there's also psychiatric, but not for the autism per se, mainly for any other types of mental health symptoms they may be experiencing, including anger or some symptoms of different types. So applied behavior analysis is based on behavioralism and also learning theory that applies behavior experiences in real life and showing those individuals how they can change different types of behaviors, especially for family members who are witnessing these types of behavior. So I know there are these things called the ABCs, the antecedent, behavior, and the consequence. And the antecedent is typically what happens before a behavior. The behavior is what you do because of it, and the consequence is what happened after that behavior. So an example is if you made me mad and I throw something across the window and you go away, that was the antecedent, the behavior, and the consequence. Consequence was I got you to leave. So that's the type of situations that we see of individuals, or we can see with individuals on the spectrum, and how ABA can be applied. Typically, yeah, a ABA therapist might be joining in just to help facilitate any type of behaviors that the individual might be experiencing. So if you see an individual with autism coming in and they say that they're the therapist there with the parent, they're just there in the background to make sure things are okay. They might jump in every now and then to help de-escalate. And counselors, mental health professionals can also do the same thing, but mainly you're likely to see ABA therapists instead. So for any practitioner out there, just want to remind you to be able to treat the individual with respect and dignity, being able to empathize, place yourself in their footsteps, and see how you can tailor your treatment around them to be able to have a successful session with your patient, and to be able to just be a part of that team to increase their quality of life. And you being here watching this little interview, I think is the first step in you as a practitioner being able to be a successful caregiver for them or practitioner for them.